Hello students, today we will discuss about the blood supply of spinal cord. Now this is a very commonly asked question in your exam. So let's discuss what to write and how to understand this concept of the blood supply of spinal cord. Now as you know that spinal cord is a very long structure, and because it is a long structure, it is supplied by the multiple sources. So this is the first line which you have to write down in your answer, that spinal cord is supplied by the multiple sources. Clear? Now what are these sources? That we will discuss in the coming part of this lecture. The spinal cord receives the blood from the longitudinal arranged channel as well as small segmental blood vessels. Clear? So the first thing is that there are multiple sources, and these sources are arranged longitudinally as well as they are supplying from the different segments to the spinal cord. So there are two sets of the things which you have to be very clear in the initial part of this lecture, that whenever you are talking about the blood supply of the spinal cord, there are two things. One is the longitudinal channel and second thing is small segmental blood vessels. Another thing is that these blood that is drained by the longitudinally arranged veins. So whatever the venous blood is generated around the spinal cord, that is also drained by the longitudinally arranged veins, and these veins further drain into the radicular veins, which are again the segmental veins. Clear? Now, when you will talk about the blood supply of spinal cord, now you know that blood supply is always having the two part. One is the arterial supply and second thing is the venous drainage. Clear? So now when you are talking about this arterial supply of the spinal cord, as I already told you that this arterial supply is divided into the two parts. Now what are these two parts? The first part is longitudinally arranged blood vessel. Now the question comes is that these longitudinally arranged blood vessels arises from, answer is vertebral artery. So this is the first question, that vertebral artery will give rise to the longitudinal channels which is going to supply the spinal cord. The second part is about the segmental arteries. Now these segmental arteries are known as radicular artery. So this term is more commonly asked in your exam. Write short note on radicular artery. So these radicular artery are the segmental arteries which supply the different part of the spinal cord, and these radicular artery comes from the spinal branches. Now these spinal branches comes from the different arteries which lies in the vicinity of a spinal cord. What does it mean? Suppose you are having the spinal cord from your starting from the C1 to the L1, L2 level. Now in this segment of your vertebral column, you are having the posterior intercostal artery, you are having the cervical arteries, you are having the lumbar arteries. So these arteries which are present in the vicinity of a spinal cord will give rise to the spinal branches, and these spinal branches will further give the segmental arteries which are known as radicular artery. So the first thing which you have to write down, that spinal cord is supplied by the longitudinal channels as well as by the segmental arteries. The longitudinal channels are the branches of vertebral arteries, and the segmental channels are known as radicular artery, which are the spinal branches of the arteries in the vicinity of spinal cord. Now, when you will talk about the longitudinal channels, as I already told you, they are the branch of vertebral artery. Now we have this knowledge that vertebral artery has been divided into the four part for the study purpose, that you will see that this artery is having the four different part, and how it has been divided. First part is from the origin till it enters into the foramen transversorium of C6. Then you will have the second part which is vertically present from C1 to C6 foramen transversorium. Then you will have the third part, and this third part is present into the suboccipital triangle. Then we'll have the fourth part. Now this fourth part is intracranial. That means it is present inside the cranial cavity, and this fourth part is important for the today's session because the spinal arteries are having intracranial origin from the fourth part of vertebral artery. Clear? So, which part of the vertebral artery contributing in the blood supply of your spinal cord? Answer is fourth part. That means the part which is present inside the cranial cavity. So, what are the branches of vertebral artery which are going to contribute in the blood supply of spinal cord? So, there are two branches, anterior and posterior spinal artery. Clear? So, the first thing which we will come to know that the longitudinal channels are the channels which arises from vertebral artery. Which part? Fourth part. And what are the name of the longitudinal channel? Anterior and posterior spinal artery. Now, what do you mean by the anterior spinal artery? So, let us see first this image. Now, in this image, you know that there is a right and left vertebral artery. Now, from these vertebral artery, you can see that there is a origin of the right and left anterior spinal artery. That means the anterior spinal arteries are two in number in term of your origin. But what will happen as soon as they arises, both will merge with each other and ultimately you will have a single spinal artery. So, the origin is different. The right spinal artery arises from right vertebral artery. The left spinal artery arises from left vertebral artery, but you will find a unpaired one single anterior spinal artery because right and left both side arteries fuses with each other and they will present on the ventral aspect of the spinal cord as a anterior spinal artery. Clear? So, this is the important concept to understand that whenever we are talking about the anterior spinal artery, these are the direct branches of the fourth part and they arises inside the cranial cavity, which I already told you, and before meeting them they are having the separate origin from the opposite side arteries. Now, the two arteries join with each other and they descend along the anterior median fissure of spinal cord. Clear? So, now we will have the concept of anterior spinal artery. That anterior spinal artery is a unpaired artery which is present on the ventral surface, but with the origin, if you will see, the origin is of the two arteries and both the arteries join with each other to form this single artery. Now, the another important thing is that when you will have the anterior spinal artery, this anterior spinal artery run in the anterior median fissure of the spinal cord throughout the length. That means, if you will see this spinal cord, now this is upper end and this is the lower end or the conus medullaris, and you will find that on the ventral surface in whole length, you will have this line, and this is your anterior spinal artery which is present in the whole length of the spinal cord. So, this is the one thing. Second thing is that it provides small branches and these branches penetrate and supply both white and gray matter. Now, what is the meaning? Now, if you will take a section, suppose I will take the section of the spinal cord here, you know that this is your fissure. Now, this fissure is having the anterior spinal artery. Now, this anterior spinal artery is giving a central branch and this central branch is going inside and this is piercing here the inner side of your neural tissue and it is supplying both white and gray matter. So, if you will see the whole circumference of this spinal cord, this anterior spinal artery is actually supplying the almost anterior 2/3 part of your circumference of a spinal cord. So, this artery may be smaller in the thoracic region and below. So, this is again, this line is very important to understand that whenever we are talking about the anterior spinal artery basically dominantly supply the cervical region of your spinal cord. Now, this is very commonly asked question. So, you have to keep this thing in mind that in the cervical region, the main blood supply comes from the anterior spinal artery. Now, what happened about the remaining part that we will discuss in the coming part of this lecture. Now, what about the posterior spinal artery? Now, my dear students, you have to keep in mind that anterior spinal artery is unpaired artery, though there is a origin of right and left. Here, the origin is also again the right and left, but these arteries is not going to fuse. That means the posterior spinal arteries are remain separated. So, you will find there are two posterior spinal artery. Now again, these posterior spinal arteries are also intracranially in origin. Now when you will see the origin of the posterior spinal artery, they arises from either the fourth part of the vertebral artery or from the posterior inferior cerebellar artery. So now in this image, you can appreciate that there is a posterior inferior cerebellar artery. Now this posterior inferior cerebellar artery is a branch of your vertebral artery. Now this posterior inferior cerebellar is giving the posterior spinal artery. So this is the posterior spinal artery, and sometimes this posterior spinal artery may be the direct branch of the fourth part of vertebral artery. Now each artery runs on the posterolateral sulcus of spinal cord. So you know that posterolateral sulcus are present. So now you are having the longitudinal channels. One is the anterior spinal artery, which is an unpaired artery, and you are having the paired posterior spinal artery. Now what will happen with the posterior spinal artery? Now my dear students, you have to keep this thing in mind that on each side, each posterior spinal artery bifurcate. Now this is the important concept to understand again, that it bifurcates into the two longitudinal collateral channels. So one lies on the anterior and one is on the posterior aspect of the dorsal roots of your spinal nerve. So now how many longitudinal channels form? One channel is anteriorly placed. Now this anteriorly placed channel is known as anterior spinal artery. Now posteriorly, on the right side you are having two channels, on the left side you are having two channels. Now these both longitudinal channels are branch of posterior spinal artery of right side, and these both are the branch of posterior spinal artery of left side. Clear? And this is what arrangement you are able to see all around the spinal cord in terms of the arterial supply. So you will find there is a 1, 2, 3, 4, 5 longitudinal channels are present to supply the blood to the spinal cord. Clear? So sometimes you have this question that there are 5 longitudinal channels are present, unpaired anterior spinal artery, 2 longitudinal branches of right posterior spinal, and 2 longitudinal branch of posterior spinal artery. Clear? Now these arteries on the posterior side are present along the dorsal root of spinal nerve. Now, the anterior spinal artery, as I already told you, it supplies the anterior 2/3 part of the spinal cord. So, suppose this is the circumference of your spinal cord. You can divide this circumference in the two parts, anterior 2/3 and posterior 1/3. Now, this posterior 1/3 is supplied by posterior spinal, and this anterior 2/3 is supplied by anterior spinal artery. Now, there is a very important short note which comes as a separate short note, right short note on segmental arteries of spinal cord. Now, my dear students, first you should understand what is the need of these segmental arteries. So, when we will have the blood supply of the spinal cord, you know that the blood received from the vertebral artery through the anterior and posterior spinal artery is sufficient only, now this word is important, only for the cervical part of spinal cord. So the question is that why there is a need of segmental artery? So whenever you are having this question, you have to first understand that only the cervical part, that means the upper 7 and 8 segments of the spinal cord, are receiving the blood in ample amount from the anterior and posterior spinal arteries, which are the branch of vertebral artery. So whenever you are talking about the remaining part of the spinal cord, they are not receiving the sufficient amount of the blood. So therefore, these anterior and posterior spinal artery ramify. Now this word is again the important, that you are ramifying the blood supply to this anterior and posterior spinal artery. So therefore, the anterior and posterior spinal arteries ramify and they receive the blood from many anastomosing branches from the segmental vessels in vicinity of your spinal cord. Clear? Now, these segmental arteries arises from, what is the source of these arteries? These arteries arises from vertebral artery, deep cervical artery, posterior intercostal artery, and lumbar artery. Now in this image you can understand that this is your vertebral column. Now inside the vertebral column, you are having the spinal cord. Now here you are having this aorta. So this is aorta which is giving the branches. Now these are the intercostal arteries which are arising at these level in the posterior wall of chest. Now these arteries, these intercostal arteries will give the spinal arteries, and these spinal arteries will enter into the your vertebral canal, and these are now termed as a segmental artery. And what is the function of these branches of the posterior intercostal? They will ramify. That means they will provide additional blood supply to the spinal cord. And which part? The area below the cervical part. Why? Because the anterior and posterior spinal arteries are not sufficient enough to supply whole length of spinal cord. That's why initially in the first slide I told you that whenever you are talking about the blood supply of the spinal cord, it is not only the longitudinal channels, but you are having the segmental arteries also. So what is the need of segmental artery? Now if somebody will ask you this question, you should reply that the longitudinal channels are not sufficient enough to supply the whole length of a spinal cord, as the sufficiency is end at the lower border of cervical segments. Clear? Now next, in this image, if you will see the same arrangement, you will find that this is your aorta. From the thoracic aorta, these are the your intercostal artery, posterior intercostal artery. Now here you can see that this posterior intercostal is going to run in your intercostal space. But apart from that, it is going to supply intercostal space. It is giving a dorsal branch. Now this dorsal branch of your intercostal artery is giving the spinal artery, and this spinal artery is giving the segmental or radicular artery, which are supplying, or you can say ramifying, the blood area which is supplied by this anterior spinal artery. Clear? So now with this image, it is very much clear to us that the area which is receiving the blood from the anterior spinal artery is also receiving the blood from these segmental arteries. So what is the purpose of segmental arteries? The segmental arteries will ramify the blood supply of anterior and posterior spinal artery. And what is the source of the segmental arteries? The source of segmental arteries is the arteries which lies in the vicinity of spinal cord. For example, posterior intercostal artery, lumbar artery, deep cervical artery. Now, each of these segmental arteries enter the vertebral canal through corresponding intervertebral foramina, and they will reach to the spinal cord. So this is again the second question, that how your segmental artery approaches the spinal cord. So now in this image, you can see that this is what is known as intervertebral foramina. That means, inter means between the two adjacent vertebrae. So through these intervertebral foramina, you can see that this artery is entering inside. So the artery which is entering through the intervertebral foramina is your segmental artery. Clear? So what is the first question is, what is segmental artery? Second is, what is the need of segmental artery? And third is, how it approaches the spinal cord. So it approaches the spinal cord through the intervertebral foramina. Now these segmental arteries are also known as radicular artery, which is a more commonly asked question in your exam. Write down the short note on radicular artery. So now what will happen with the segmental artery? That segmental artery divide into the two branches, anterior and posterior radicular branches. Now these anterior and posterior radicular branches of the segmental artery join the anterior spinal as well as the posterior spinal artery at various segments and provide blood to these long vessels. So now this concept is clear, that whenever you are having the anterior and posterior spinal artery, the blood which is present in anterior posterior spinal artery from the vertebral artery is not reaching up to the lower end. Though the anterior spinal artery is running on the ventral surface in whole length, but in the lower part, the anterior spinal arteries are receiving the blood from these segmental artery, and then they are supplying the part of your spinal cord. Clear? So up to the cervical region, the anti-spinal arteries are having empty of the blood the blood is coming from the vertebral artery, but in the lower part, the anti-spinal arteries are receiving blood from the segmental arteries. So now this is the enlarged view here. Now what you are able to see is that this is your posterior intercostal artery. Now this posterior intercostal artery is giving the dorsal branch, and this dorsal branch is giving the spinal artery. Now from the spinal artery, this is the origin of the segmental artery, which is known as radicular artery. This is your intervertebral foramina. Radicular artery is entering inside and it is dividing into the anterior and posterior radicular branches. Clear? Now the next thing is that what is radicular artery? So now you should have the concept. Somebody will ask you, what do you mean by the radicular artery? Then you should always reply in these bold lines. The first thing is that radicular arteries are not longer arteries. These are the small feeders. Clear? They are going to feed anterior spinal artery, and then the anterior spinal artery will supply blood to the remaining part of spinal cord. So these are the small feeder vessels, and these arises from the arteries in the vicinity of spinal cord. This is the first definition. Second concept is that they are also known as segmental medullary arteries. So this is again the important line. Then the third thing is each radicular artery enters into the vertebral column through the intervertebral foramina to approach the spinal cord. Then each radicular artery divides into the anterior and posterior radicular arteries, and they runs towards the spinal cord along the ventral and dorsal nerve root respectively. Clear? The radicular arteries provide mainly the blood supply to the thoracic, lumbar, sacral and coccygeal segments. It is segments because you know that the coccygeal segment end at the level of L1 vertebrae. So they are going to supply the segments of spinal cord, not the cervical segment, because I am saying this again and again that anterior and posterior spinal arteries are having sufficient blood to supply the cervical region. But as you will go down, the amount of the blood is decreased, and that amount is ramified by these small feeder vessels. So while the branches of the vertebral artery mainly supply the cervical segment. So the cervical segments are having ample amount of the blood directly from the vertebral artery through anterior and posterior spinal. Now there is one more question about one larger artery. Now this larger artery is a radicular artery. Now you know that radicular arteries are present on both right and left side, but out of the all radicular artery, a single anterior radicular artery. Now see, we have seen that the radicular artery divides into the anterior and posterior division, but when we will talk about a large radicular artery, it is always the anterior branch, not the posterior branch. So one of the anterior radicular branch is become excessively large, and this is called as arteria radicularis magna, or it is also known as great ventral radicular artery, or it is also known as artery of Adamkiewicz. Clear? So now you will have this question in exam that arteria radicularis magna is a branch of. So always you have to understand that it is a anterior branch. I have told you that there is a spinal artery. Now this spinal artery is giving the segmental artery. This segmental artery is dividing into the anterior and posterior radicular artery. So this is the anterior and this is the posterior radicular. So this anterior radicular is going to form this large artery. Clear? So it is the largest inconsistent. That means it is not always present, and it is present at the variable level. The level of this large artery is also not fixed. It usually arises from a spinal branch of the lower posterior intercostal arteries. That means it is present in the lower thoracic region and upper lumbar region. So it is the important thing to understand that this is found into the lower thoracic and the upper lumbar level. Now in this image, if you will see that this is your posterior intercostal artery, which is giving the dorsal branch, and here you can see that this is the artery. Now this is the anterior branch or anterior radicular artery, and this anterior radicular artery is excessively long. Generally the radicular arteries are not that much long. So this is what you have to understand about the single artery, and this single anterior division is a large, which is having a variation. It is a highly variable artery. Now in majority of the individual, you will find that it arises from the left side and it follows the course of anterior root. Now this is again the very important MCQ for your exam. Whenever you are having this large magna artery, the question comes is that it is present along the ventral side or dorsal side of the spinal cord. Always you have to understand that it is present on the ventral side of the spinal cord. And when you are talking about the ventral side of the spinal cord, but obviously it always follow the anterior or ventral roots of spinal nerve. So this is what you have to understand, that it always follow the course of the ventral root or the anterior root of the spinal nerves which are attached on the spinal cord, and then it enter into the vertebral canal through the intervertebral foramina. Clear? So you know that each spinal nerve is having the two division, ventral and dorsal nerve roots. So this artery is present along the ventral nerve or the anterior nerve roots, and it is usually, if you will see the presence of this artery, it is usually enters through the intervertebral foramen at the L2, L3 level, and as it reaches the spinal cord, it sends a branch to the anterior spinal artery and a smaller branch to ramify the posterior spinal artery. So now what you are able to understand with this artery, that there is a artery which is a anterior radicular artery, there is a artery which is excessively larger, there is an artery which generally arises on the left side, there is an artery which runs along the anterior root of spinal nerve. This artery generally enters through the intervertebral foramen of L2, L3 level, and this artery mainly ramify the blood to the anterior spinal artery. So it is responsible to reinforcing the blood supply to the spinal cord and maybe or the mainly supply to the lower two-thirds of the spinal cord. Clear? So sometimes this artery is too large that it is become the main source of the blood supply to the anterior spinal artery to the lower two-thirds of your spinal cord. So this artery is considered to supply blood to lower two-thirds of spinal cord as well as to the anterior roots. Clear? So what is the important concept is that this is your vertebral column. Now this vertebral column is having the spinal cord. This spinal cord is having the anterior spinal artery. This anterior spinal artery is receiving a artery which is a anterior radicular artery which is excessively large, and this excessively large artery is ramifying the blood to this whole lower part of the anterior spinal artery. So this is what you have to understand, that there should be no confusion that if this anterior radicular artery which is excessively large if present, then there is an absence of anterior spinal artery. No, anterior spinal artery is not absent, anterior spinal artery is present, but the answer is that the blood into the anterior spinal artery coming from this anterior radicular artery. So if I will block this anterior larger radicular artery, then the blood entry into this lower part of anterior spinal artery is going to hamper. Clear? Now what we are able to understand from this arterial supply, that all the blood vessels which are supplying the spinal cord are, one is anterior spinal artery, then you will have four posterior spinal arteries which are the two on right side, two on the left side, and there are two spinal segmental arteries which are coming from the arteries in the vicinity of the spinal cord. So in total you will find that there are 6 arteries which are supplying a single segment. If you will see the segment of a spinal cord, it is having the anterior spinal artery, it is having the 4 posterior spinal artery and 2 segmental arteries. So all these 6 arteries are anastomosing around the spinal cord and they are supplying the whole neural tissue. So the central branches of the anterior spinal artery enters through the anterior median fissure, while These branches enter the right and left side to supply the anterior gray horn, lateral horn, base of the posterior gray horn, and adjacent white matter of anterior and lateral funiculi, that means white matter. So, this anterior spinal artery is supplying your anterior gray horn, it is supplying your lateral horn, it is supplying the base of your posterior horn, and it is also supplying the anterior and lateral white matter column. While your posterior spinal artery is supplying the remaining part, that means the remaining part of the posterior horn and the posterior column of white matter. So, the anterior 2/3 is supplied by the anterior spinal artery and posterior 1/3 is supplied by the posterior spinal artery. Now, what do you mean by the venous drainage? Now, when you will see the arterial supply, whatever the blood is going, it is drained by the veins, which are again having the two pattern, longitudinal as well as the segmental veins. So, there are 6 longitudinally arranged veins, and these veins are draining the spinal cord. So, one vein is running anteriorly along the anterior median fissure, then one along the posterior median sulcus. Now, these are the two. Now, apart from that, you will find the 2 along the line of right and left ventral nerve root and 2 along the line of right and left dorsal nerve root. Clear? So, when you will see the spinal cord, this is your anterior vein, which is present along the anterior nerve, anterior median fissure. Then you will have one vein which is along the posterior median sulcus. Apart from that, the 2 veins on the both ventral root line and 2 vein along the dorsal root line. So, in this way you will find 2 plus 2 plus 2, 6 longitudinal venous channels which are present all around the spinal cord. So, now in this image, if you will see, this is the your ventral surface. So, you will find this is the one vein. Now, where is the vein? Now, if you will see the veins, this is the one vein which is present anteriorly, this is present posteriorly. Clear? Now, there are veins which are present along the attachment on your ventral, and there is a vein which are present along the dorsal roots. Clear? But the another longitudinal channels are also present. So, when you will see these longitudinal channels, the number of the longitudinal channels are variable, but anterior and posterior longitudinal veins are always present. The veins along the ventral and dorsal roots are also always present. Clear? Now, these veins which are present all around the your spinal cord, they are present in the pia mater. Now, these veins are going to drain into an internal venous plexus. Now, you can see that this is your inner side of vertebral canal. Now, in this vertebral canal, what you will find that this is your epidural or extradural space. Now, in this epidural or extradural space, there is a presence of this venous network, and this venous network is known as internal. This is known as internal venous plexus of vertebral column. So, it is known as internal vertebral venous plexus. It is not external. External will come, which is present here on outer side of vertebral canal. Now, this venous plexus is present inside the vertebral canal, outside the dura mater, and it is present in extradural or epidural space, and it is known as internal venous plexus. Clear? So, these veins ultimately drain into this internal venous plexus. So, when you will see the venous drainage of this spinal cord, you have to understand that here again we have removed the whole bony channels, and you can see outside that these are longitudinally arranged veins in the extradural space, which are going to form your internal venous plexus. And this space in extradural space is receiving the veins which are present here, which I just told you, and these veins are ultimately going to drain into this internal venous plexus of your vertebral column. Now, all the veins which are present around the spinal cord freely communicate with each other, and they drain in anterior and posterior radicular vein. And these radicular vein ultimately communicate or drain into the internal vertebral venous plexus. So I just told you that where is the location of internal vertebral venous plexus, in extradural space or in epidural space. That's why it is also known as epidural venous plexus, which is present in the fat, which is present in the extradural space. So what is happening, that he will have the longitudinally arranged vein. Now these veins are drained by the radicular vein, and these radicular vein are draining into the internal vertebral venous plexus. Clear? Now this internal vertebral venous plexus communicates above. Now this is what is very important, that these vertical veins which are present in this epidural space, now these veins will enter inside the cranial cavity vertically. And where they will approach? They will approach to the dural venous sinuses which are present all around the brain. So there is a very important dural venous sinus which is known as cavernous sinus. So when you will read the cavernous sinus, you will find that cavernous sinus receives the blood from these internal vertebral venous plexus. So that's why you have to understand that suppose there is any infection occurs in this extradural or epidural space, that infection can ascend through these vertically present venous plexus and it may enter into the cavernous sinus. So what is happening, that the venous drainage of your spinal cord is important, that the veins which are draining the spinal cord are present all around the pia mater, but they ultimately connected with these veins of the extradural or epidural space by the radicular veins, and then these veins of extradural space are going to drain into the cavernous sinus. The internal venous plexus also communicate with the external plexus through the channel in intervertebral foramina. Now what do you mean by this? Now when you will see the extra or external vertebral venous plexus, it is the veins which are present outside the vertebral canal, or you can say they are present outside the vertebral column. Now the connection between these external vertebral venous plexus, there is a intervertebral foramina, and through this intervertebral foramina the segmental veins are coming out and they are connecting this external vein with this internal vein. Clear? So the internal plexus vein are communicating with the external plexus veins through the channels which are passing through the intervertebral foramina. So the blood from the external venous plexus empty into the vertebral vein, intercostal veins and lumbar veins. So what will happen? Ultimately, the blood from these external veins will go into the veins present in the vicinity. Like if it is a posterior wall of the chest, then this blood of the vein will enter into the posterior intercostal vein. Clear? So now here in this image, what you are able to understand, that there are two sets of the veins which are visible here. Now these are the veins which are external veins. Clear? Because they are present outside the vertebral column. Now these are the veins which are present in the extradural or epidural space. So these are the internal vertebral venous veins. Now these internal vertebral venous veins are receiving the blood of the spinal cord, and these veins are connecting by these channels, and you can see that this azygous vein is receiving the posterior intercostal vein. So the external vertebral venous plexus is receiving the blood from the internal vertebral venous plexus by this communicating channel, and ultimately the vein is draining into the azygous system of vein. Now we'll move to the last part of the lecture, that means the applied aspect. Now the applied aspect is that what will happen if the blood supply of spinal cord hampered? The answer is ischemic neurological injuries. Now ischemic neurological injuries means that the injury of the nerve tissue occurs because of the ischemia, that means due to the lack of blood supply. And this lack of blood supply could be occurred due to the anterior spinal artery blockage, or it could be due to the injury of spinal nerve roots. Now this is what is the important concept to understand, that when the spinal nerve root is cut, why there is a loss of the blood supply to that segment. And lastly, it could be due to the blockage of the arteries which are in the vicinity of spinal cord, for example, occlusion of posterior intercostal artery. So first I will tell you what is spinal artery syndrome, particularly the anterior spinal artery. So if the anterior spinal artery is occluded, what will happen? You know that the blood supply of anterior two-third is going to hamper, and what will happen in this condition? It will lead to the motor loss. Now, why there is a motor loss? Because there is an involvement of the alpha motor, gamma motor neurons of the anterior horn. Plus, along with that, you know that it is supplying the anterior and lateral column of white matter. So, where you are having the descending tracts like corticospinal. So, the nerve supply to the corticospinal fibers will also hampered. Similarly, it will also affect the pain and temperature because there is ischemia occurs to the fibers of spinothalamic tract. But in the anterior spinal syndrome, the posterior column fibers, that means the fasciculus gracilis and cuneatus, are not going to involve. So, the sensation carried by the posterior part of your column is not going to affect. So, this is what you always keep in mind, that in this condition there is no effect of the fasciculus gracilis and cuneatus as they are supplied by the posterior spinal artery, which are present in the posterior column of white matter. So, whenever you are having the anterior spinal artery syndrome, you have to keep in mind that it is the involvement of the anterior spinal artery where there is a sparing of the columns which are present in the posterior column of white matter, that means fasciculus gracilis and cuneatus. Now, why there is a involvement of the blood supply of the spinal cord when there is an injury of spinal nerve root occurs? This is the important thing to understand, that it should be always stressed that the radicular artery. Now, see, the radicular arteries are very important. I just told you why radicular or the segmental arteries are extremely important, because they are responsible for the ramify of the blood supply of your spinal cord below the cervical region. So, because they are, with the exception of the cervical region, the anterior and posterior spinal arteries are unable to provide the adequate blood to the spinal cord. So, these blood or the feeder arteries are giving the blood to the anterior and posterior spinal artery, and through them the blood is now entering into the remaining part of the spinal cord. Now, therefore, if there is injury of the spinal root, what will happen? Now, this injury of spinal root causes damage not only the afferent and efferent fibers, particularly the spinal cord level, but there is a damage of the segmental white and grey matter blood supply also by producing the ischemic condition, because there is a entry of the radicular artery, and we have seen that the segmental artery enters through the intervertebral foramen, and then it divides into the anterior and posterior radicular artery, and these radicular artery runs along with the spinal nerve roots. So, whenever you are cutting the spinal nerve roots, there is a cutting of the anterior and posterior radicular artery also, because they are very proximally or intimately related with the spinal nerve roots. So, this is what you always keep in mind, that why there is a ischemia occurs in case of the spinal nerve root injury, because the spinal nerve roots are also having very close relation with the anterior and posterior radicular branches of your segmental arteries. So, if the spinal nerve root will cut, along with that you are cutting the radicular arteries, and once the radicular arteries will get damaged, what will happen? The blood supply, or you can see the feeding of your anterior posterior spinal artery is going to damage. So, ultimately when the blood supply will decrease, it will lead to the ischemic neurological injury of spinal cord. The lastly is that if there is occlusion of the arteries in the vicinity, for example, if there is occlusion of intercostal artery, again what will happen? There is a ischemic neurological injury of spinal cord occurs. Why? Because these arteries are responsible to give origin to the segmental feeder arteries of spinal cord. Clear? So, now at the end of this class, you are able to understand what do you mean by the longitudinal channels, what do you mean by the radicular arteries and segmental artery. What is the most important concept is that the anterior and posterior spinal arteries are not adequate to supply whole length of the spinal cord. So, below the cervical region, they have to again refill, and that refilling is done by the feeder vessels which are known as segmental arteries, and these feeder vessels enter through the intervertebral foramina which arises from the major arteries in the vicinity of spinal cord. Clear? So this is the basic concepts about the blood supply of spinal cord, and this is all for the today's lecture. Thank you.